Mr. Speaker, my friends on the other side of the aisle have now tried more than 54 times to repeal the Affordable Care Act in some fashion. Today, they're at it once again, offering the so-called Orwellian-named Save American Workers Act. I'm still trying to figure out what they're trying to save the American workers from. Good health care? Doctors? Nurses? Free preventive checkups? The denial of insurance based on a pre-existing condition? Exactly what are you trying to save them from? Despite the repeated distortions and assaults, the Affordable Care Act is working. In the most recent open enrollment, more than 6.5 million people have registered for or renewed their health insurance coverage through the marketplace exchange. And open enrollment will continue through February 15th of this year. And just new data shows the uninsured rate has sunk to 12.9%, a 4-point drop in the past year and one of the lowest in decades. Many of these are our constituents who, without the Affordable Care Act, would not have health insurance. They're realizing the benefits of a patient-centered insurance model in which their coverage cannot be rescinded or denied because of a pre-existing condition and does not put them at risk of bankruptcy in the event of an emergency. But my friends on the other side will not be deterred in their zeal to repeal at any cost, no matter who it hurts, even if it means abandoning their own professed principles. The Congressional Budget Office says this bill would increase the federal deficit by at least $53.2 billion over the next 10 years. I thought my colleagues wanted to reduce the deficit, which is exactly what the Affordable Care Act does do, to the tune of $109 billion over the same period. But rather than save workers, as its title would suggest, I'd ask 15 more seconds.
15 seconds.
This bill will actually sabotage them. Again, CBO says 1 million people who currently have insurance will lose it under the Republican plan today, half of whom will have to go to Medicaid and the other half will just be left on the street. Mr. Speaker, American workers need Affordable Care Act. I urge my colleagues to oppose the rule and the underlying H.R. 30. I thank you.